Hello, everyone, and welcome to this episode of Office Hours. I'm your host, Stuart Newsome. Today, we'll be discussing a critical topic in healthcare administration, which is the challenges and solutions surrounding prior authorizations, specifically focusing on the pitfalls of marking them as stat. We certainly want to take a look at this from the standpoint of, is putting something or a prior auth as stat really necessary? Um, we had a guest that was scheduled for today, Jennifer Glockson, but unfortunately, she was considerably affected by Hurricane Beryl. I believe that's how you pronounce that hurricane. I'd never heard that name before, but I believe that's what they were calling it. But we certainly want to lift her up in prayers and really wish that she was here with us. I promise you that she would add a whole lot of expertise and information regarding this subject matter because she lives it. She is our senior manager of patient access here at Infinix. And I've spent a lot of time prepping for this episode with her, so I feel that I'm up to speed. I knew about this subject matter already and how sometimes it can be a misconception surrounding this, but nonetheless, we have plenty of valuable content to cover. So also just want everyone to remember that we have a Q&A session that you can actually participate in. If you have a question, we will have some time at the end of this episode for you to have a Q&A. So I encourage you to go ahead and post your questions in the Q&A section, and we'll get to them to the best of our ability. If I can't answer this, we'll definitely have Jennifer can probably reach out to you as well regarding that. So with that, we'll just dive right in. So our session today, obviously, is titled Navigating the Pitfalls of Stat Authorization. This aims really to shed the light on the intricacies of prior authorization in healthcare. So I just want to ask a question. Have you ever wondered if marketing prior authorization as stat actually speeds up the process? Have you ever done this yourselves? It certainly seems reasonable that if I were to put stat on a prior auth request, it would be processed faster, right? At least that's the rationale. Well, we're going to explore this question a little more as we discover it may make things worse, actually. So we all know the role of prior authorizations, as well as the headaches and struggles that they cause. We've certainly spoken about this many times here at office hours because it continues to be the most common denial and the root cause of a lot of frustration. While they're intended to ensure that patients receive appropriate necessary care, it often leads to delays and administrative burdens for healthcare providers. So we all know the headaches that are involved. Now, according to the AMA, significant changes are needed to fix the prior authorization process. And I can tell you that's such an amazing revelation. I think we all would agree, probably would have came up with that assumption on our own. But one common misconception, which is what we're going to discuss today, is that labeling a request as stat or expedited will speed up the process. However, insurance companies have strict criteria for what qualifies as an expedited request. And we all know insurance companies may vary on what qualifies as an expedited request. So not only will they have certain qualifications, but one qualification may apply for one insurance company that may not apply for another insurance company. Typically, they limit these situations involving potential loss of life or possibly loss of limb. Insurance companies refer to expedited requests as those involving severe health risk. Now, that's a very key word. I know we understand levels of severity being in healthcare, but then they may have different definitions of what they feel is severe health risk. So if that health risk is not evident, again, you need evidence that that health risk is there. Just want to refer, this sounds a whole lot like our old friend medical necessity, right? They have the authority to reclassify a request from stat to routine without even notifying the provider. So this reclassification can result in significant delays, as you could imagine, as routine authorizations can take anywhere from 7 to 14 days. So mislabeling a request as a stat can actually backfire. So you can see the ramifications probably already forming in your head. that when a request is reclassified to routine, providers often remain unaware until they follow up. There really is no status that they give to you that they've done this action. So you're assuming I sent this in a stat, it's a still stat. Hey, what's going on? You do a follow up and then you find out they reclassified it as routine. They don't even have to notify you of this. Furthermore, reclassifying resets the processing clock. So that's going to cause further delays, right? So this process becomes even more strained when patients receive the initial bills directly because the tests were marked as urgent without confirmed coverage. For instance, patients might find themselves facing a $12,000 bill for a PET scan that was ordered stat, but not approved in time by insurance. This not only escalates financial stress, but also creates tension among the patient, the facility, as well as the providers on who end up in this triangular blame game with the insurance companies. And I speak from this from experience. I've actually been on the phone with providers, facilities, and insurances about certain claims that have affected my family. And I know what I know about prior authorization, and it's a struggle. You imagine a patient who has to do this as well, who doesn't have any clue, and they're just not familiar with the process. So let's discuss some strategies to navigate these challenges effectively. So first of all, accurate documentation is crucial. You've heard me say this ad nauseum, that documentation is key. Most people, again, associate documentation with E&M coding or documentation with medical necessity. Surely this is no different. You have to make sure the documentation is accurate and make sure that it has detailed and thorough documentation to support the urgency of the request. Again, it's all about the urgency. Using specific phrases and detailed descriptions can help convey the necessity for the expedited processing. Providers and their staff should ensure that all necessary documentation and justifications are thoroughly prepared when submitting authorization requests. So this can help reduce denials or delays based on inaccurate information. This also goes into coding. You need to make sure that your coding reflects what's in the medical record that's going along with that prior authorization. If that code is not accurate, or if you don't use multiple codes to explain the severity of the situation, then it's lack of medical necessity. Again, I've always said coding is a language. It's the language that insurance companies use to understand what happened at the patient's encounter, what is the patient's condition. It's the basis of medical necessity. Documentation surely should back that up, and documentation is very important. But that first wave, it's all about the coding. So effective communication is also another key strategy. Obviously, communication is key in anything. It's key in any relationship you have, and it certainly is no different with the relationship that you have with your payers. So you need to train your authorization team to be knowledgeable and also persistent. Persistent is the key word there, that when dealing with insurance companies, for instance, you need to be speaking with the nurse case reviewer rather than that frontline representative. This is going to yield better results because we all know that the person answering the phone the first time, they're just checking boxes. They're following a script. They have certain protocols that they have to meet to where they can answer that question if it's a high level question. But when it comes to something that's severely a health risk or needs to be stat, and you need to explain this to the payer, that nurse case reviewer is going to give you a better shot at that because they're going to understand the situation a little better. Still may deny it, still may assess it as routine, but you're going to save a whole lot of time going direct to them. Just go ahead and ask for them. Now, providers and healthcare organizations need to unite, obviously, also for advocacy efforts as well, against any of those cumbersome insurance practices. So engaging with organizations like CMS to push for policy changes that expedite care without compromising any procedures is very essential. Again, the AMA continues to lobby for state and federal legislation that would set a 24-hour time limit for urgent cases and 48-hour time limit for non-urgent cases. Patient advocacy is also very critical. So we want to educate patients about their role and their rights in the authorization process. And I know what you're thinking. What role does the patient have? Well, statistically, and I don't have the actual numbers on this, but I know that just from speaking to our clients and speaking to others, that there's a higher degree of success with that prior authorization if the patient does get involved. So you want to encourage them to contact their insurance company directly and express dissatisfaction if their needs are not met. Informing patients about how health insurance works also includes how the stats are ordered and the prior authorizations are performed, can really empower them to be more understanding and proactive about their care plans. Leveraging contract negotiations with health plans can also be a strategic approach. Providers can argue for faster turnaround times on authorizations, reflecting their commitment to timely patient care. So it's very vital for healthcare providers to ensure that their administrative and prior authorization teams are well informed and equipped to handle these situations. Regular training sessions and updates on insurance policies can help streamline this process. I've always stated, again, there seems to be a theme where we repeat issues about documentation, medical necessity, as well as issues with prior authorization, but another one is training. Training is essential. I know there's shortage of staff, low FTE counts, maybe there's just not enough time for training, but you got to get creative in how those training sessions can occur and make sure that they're just well informed and educated, because it's just going to make life easier in the long run. Another factor is artificial intelligence and automation. These two play a significant role in mitigating these challenges. For example, AI can preemptively identify the need for clinical records before submission, ensuring compliance and reducing delays. Automating the documentation and submission processes can even streamline operations and enhance accuracies. I know here at Infinix, we use AI as a part of the equation where we can even let you know if clinical records are even needed beforehand. So you don't have to send off that prior authorization, even in a stat mode. And then it's delayed when they send you back a message saying we need more documentation. We can go ahead and tell you that ahead of time. And you go ahead and send that clinical documentation along with the prior authorization, and they'll already have it. They still may come back to you and say, we need it, but you can already tell them, we sent it. Look at the attachment. So understanding the complexities of prior authorization is obviously very crucial for providing timely and appropriate patient care. But providers often find themselves in a predicament where, despite urgent medical needs, like a patient requiring immediate surgery for a ruptured disc, they are compelled to follow insurance mandate procedures, such as conservative therapies that may not be immediately beneficial. So there needs to be a system where providers can contest such mandates effectively based on medical necessity. So you have providers who have accurate clinical judgment about the care of patients that are going up against certain protocols and criteria that, for the sake of cost containment, and I have air quotes around that, that's really what prior authorization is all about, is cost containment, cost management, but it just ends up being a nightmare, as we all know. Moreover, the challenges do not end after obtaining initial authorizations. There are instances where surgical procedures often reveal additional issues that were not visible in the initial assessments. This is really leading to the need for more extensive interventions than previously authorized. So this necessitates a quick reauthorization process to avoid patient liabilities for any unforeseen surgical expenses. So to summarize here are some of our key components and recommendations that we're offering. So enhanced documentation quality to clearly justify the urgency of the request. Again, train authorization teams to effectively communicate and escalate issues within insurance companies. You want to educate patients, get them involved on how to advocate for themselves and understand their insurance rights. And then utilizing AI and automation tools to streamline the prior authorization processes. Now, with all of this, I invite you to contact us if you want more details on any of this, particularly on how AI and automation can help you streamline the authorization process. You may find some value in that. We may need to collaborate and share some ideas with you. Be more than happy to do that. So if you can contact us, that would be amazing. We'd be happy to speak with you. I do want to thank you for joining us today. I'm now open to any questions you may have about prior authorizations and the strategies that we've discussed. Um, just want to work together to improve the efficiencies and effectiveness of our healthcare systems. I know here at Infinix, we're looking at ways in which that efficiencies can be improved, but it needs to be a collaboration. I'm a full believer in collaborating with not only our clients to understand, how can we make the processes much faster, much easier, not only through automation, but also through human resources, but also just learning from industry experts, going to these organizations and trade shows and perhaps other entities that you can get educated on how to make the processes much easier. So with that, I will turn it over to some Q&A. So if there is a question, feel free to go ahead and place that in the chat. I'll be happy to go ahead and start answering those as necessary. We do have one question that is available here. It says, given the strict criteria for expedited requests by insurance companies, what specific documentation or phrasing can we use to better justify the urgency of a stat authorization to avoid reclassification to routine? Okay, well, that's covered a little bit of that in what I was stating earlier. So I'm just going to expand on that just a little bit and re-elaborate a little bit on that. So to better justify the urgency of a stat authorization and avoid that reclassification to routine, it's essential to include detailed and specific information in your documentation. So again, here's some strategies. It's all about detailed medical necessity. You want to clearly explain the medical necessity of the expedited request. Why is not only is why is this prior authorization needed, but why do I need it like now, right? So there's two things going on there. You need to include specific details about the patient's condition. What are the symptoms? Again, that goes to coding, and how the delay could negatively impact their health. What's the risk? What's the health risk if this doesn't happen really soon? For example, instead of simply stating patient experiencing back pain, you could document patient experiencing severe debilitating back pain, right? Impacting mobility and daily activities. So it's all in the wording. Unresponsive to conservative treatments over the past 3 weeks. Some documentation that really paints the picture of what's going on. And if you can translate all of that to coding, also do that as well. The more you have, the better. Two, you have some potential consequences. You describe the potential consequences of not expediting the authorization. You want to highlight risks such as deterioration of the patient's condition, significant pain, or the potential for emergency situations. I like this one. One consequence is you're going to pay more later if we don't take care of this now. What we're going to do now today is going to be less expensive for you, uh, Mr. Payer, if we don't go ahead and take care of the problem, because it's going to get worse later. You also want to use clinical terms. Utilize clinical terms and standard medical criteria that align with insurance company guidelines. You want to make sure you're reflecting, kind of speaking their language. Right? Phrases like urgent medical need, imminent risk, critical intervention required. These all can be signals for urgency, right? And then you want to have supporting evidence. You want to include supporting evidence such as diagnostic test results, specialist recommendations, perhaps some previous treatment records that demonstrate those didn't really work. This will facilitate the necessity for that urgent intervention. You want to attach any other medical literature or guidelines that may support the expedited care. I know this is all going to take a lot of effort. You may think, oh gosh, it's going to take a long time to put all that together, but it's very crucial. And every good EHR should have this information as well. If you're tracking it, if you're pulling it in for that patient encounter, to pull that together. And then lastly, again, going back to that nurse case reviewer. if possible, request a consultation with a nurse case reviewer when you're talking to the insurance or their medical director at the insurance company. That's another key person you probably could speak with. They're more likely to understand the clinical urgency and approve the expedited request rather than just an algorithm or a guideline. So by ensuring your documentation is thorough and clearly articulate, it paints that picture of urgency and potential risk. You can increase the likelihood of insurance companies approving the expedited request. So, see, we have another question here. How can we effectively educate our patients about the prior authorization process and empower them to advocate for themselves, especially in situations where delays in authorization can impact their treatment and financial situation? Yeah, this can be challenging. I can understand the fear in that. Educating patients about prior authorization process and empowering them is actually crucial. Again, I think when a patient gets involved, there's a likelihood of that chance of that prior authorization coming through increases because they're getting hit from the patient. The patient is the customer, even though their employer or whatever may be paying, the insurance rates and the bills. Still, these insurance is a business, and they want to keep that business. So it's crucial for the patient to be involved in these situations when there's some resistance, so to speak. So how do you do this? How do you educate them? Right. So clear communication. You want to start by clearly explaining the prior authorization process. Most people understand it at a high level, but you want to use simple, non-technical language to ensure they understand why prior authorization is needed and how it affects their care. Again, where we're using clinical terminology with the insurance company, sometimes non-clinical terminology is very helpful for the patient because they don't understand, our acronyms, the alphabet soup of healthcare, I like to call it. They don't necessarily understand, the processes when you say, prior auth or stat. They're like, huh, what? So you need to just kind of, bring it down to a level where they can understand from a non-technical standpoint. And provide educational materials. You can actually create and distribute educational materials such as brochures, handouts, maybe some online resources that outline the steps involved in obtaining that prior authorization, include tips on what patients can do in that process. And encourage them to be proactive. Encourage them to stay informed about the importance of following up with their insurance company. Provide them specific questions. Let them know, hey, you can play a role in this. Most patients feel like and some have, there's some types that feel like, oh, it's the doctor's going to take care of it. It's not my job. It's their job. They're getting paid to do this. Well, not yet. But I think some of them really would want to help because it's their care. They can take control of their care and understand, the ramifications. For instance, they can ask about the status of their authorization, what information might be needed. They can also, and the expected timeline, for the decision. These are reasonable questions that they can ask the insurance themselves. You want to empower them with knowledge. That goes back to some, education, give them some supportive tools. And then highlight the impact. Explain to the patient how their involvement can make a huge difference. Let them know that patient feedback can sometimes expedite that authorization process. And give them regular updates. Keep them informed. This is actually crucial. Just put yourself, we've all been patients, and we've all been in situations where we've been concerned or worried. So just put yourselves in their shoes because we have all been there and knows what it feels like. So it's very helpful for a patient to be informed about what's going on with the authorization process. Giving them regular updates on the status of their requests can also reduce anxiety and just kind of help them feel like they're more in control. So hopefully that answers the questions as well regarding that. Just wanted to give one last chance to see if there's any additional questions before we close out for today. I don't see any others coming in. So with that, I just want to thank everyone for joining us today, and really going through this session with me alone. Without Jennifer, I will state again, we will send a link to an article she wrote on this very subject that will give more insight. So you could expect that to be coming from me, likely in the next couple of days. Or if you just want to speak to us immediately, feel free to give us a call or contact us via our website. There's plenty of avenues out there with contact us, request demo, whatever. We will get back with you ASAP. So really appreciate everyone's attention today. And as always, we look forward for you to joining us next week on our next episode of Office Hours. So thanks everyone and have a safe weekend.